Hi everyone, my name is Camille and I would like to share with you the findings of a project we conducted on chlorine test and other acceptance to inform safe water programs in emergencies. This project was funded by the Humanitarian Innovation Fund. While water treatment guidelines stipulate what free residual chlorine levels or FRC should be at chlorination points, previous studies showed these guidelines fail to ensure adequate safety at the point of consumption, which is necessary for preventing pathogenic recontamination of stored water. In response, the Safe Water Optimization Tool, or SWOT, was developed to assist water system operators to maximize the proportion of water users having enough FRC. However, effective chlorination practices is also about dealing with the chlorine taste and other rejection concerns that may hinder the use of the water. Therefore, this work aimed to estimate chlorine rejection to make sure the two FRC boundaries were considered before improving chlorination practices via the SWOT. A sub-objective of this research was to refine a protocol for rapid evaluation that would help responders better understand and integrate beneficiary perceptions into water supply practices. The study was conducted in sectors of Chakatu refugee settlement in Uganda, served either by piped water or water trucking systems. The goal was to recruit 150 participants per water source among 5 population age and sex subgroups, as it was demonstrated that sensitivity to off flavor varies according to gender, age, and age. We used the standard methods to assess at which FRC the population started to notice the water was chlorinated by presenting 3 cups of water and asking to select which one of the 3 contained FRC. And we also assessed at which FRC the population started to find the taste of the water not acceptable by presenting a randomly ordered series of chlorinated solutions and a list of statements about the acceptability of the water. The 2 first rounds of data collection were conducted with local sources, and the 3rd round with bottled water to assess the influence of water quality. We repeated the test 3 times with each participant per water source. Other parameters, such as the range of tested FRC concentration, were adjusted over rounds of data collection to inform the method. We finished the activity with focus group discussion to identify the perception of the test with a view to improving the method for field use. Results are presented here, and the figure presents the distribution of the chlorine detection threshold on the left of the graph and the acceptability threshold on the right for the 3 tested water sources. Based on the 410 tests we conducted in triplicates, we observed that the median population detection threshold was estimated to 0.5, 1.4, and 2 milligrams per liter for chlorinated piped surface water, trucked surface water, and bottled water, respectively. The median rejection threshold was 2.2, 1.9, and 1.8 milligrams per liter, respectively. Those thresholds were integrated with the SWOT to recommend appropriate delivery FRC targets for the 2 water systems. Through those results, we also observed that the thresholds were high compared to other studies, although around 30% of participants poorly rated the solutions without any chlorine. This suggested high variability within individuals, but not specifically between age and gender, as we did not observe any significant differences. This variability was also observed over time, as the same participant did not always provide the same answer for the same chlorine concentration over the replicated test. Lastly, the thresholds were significantly different between water sources and rounds of data collection, which suggested the influence of water quality on the results, but also of the parameters when designing the test. Additionally, from the 30 focus group discussions conducted, water users mainly reported appreciating being involved in test and other testing, as they felt included and learned more about chlorinated water. However, they reported the evaluations should be less time-consuming, and they didn't like having water without chlorine, as it suggested the water was not safe to drink, nor water with too much chlorine because of the bitterness. This work presents a field method by which beneficiary perceptions of water quality can be meaningfully integrated into safe water programs in emergencies, which is important knowing there is a wide range and variability in detection and rejection thresholds among individuals. This study additionally highlights the importance to refine a protocol to ease data collection, making datasets comparable and not biased by the method and welcomed by beneficiaries. Those findings will be reported in a manuscript, and we will also work on the field protocol, as we would like this protocol generalizable across humanitarian field sites. We are always looking and working with practitioners at new sites. So feel free to reach out if you are interested in working with us on that. So I really thank you for your attention, and please do reach out if you have any questions. Thank you.